We've got 2 items on our agenda today to discuss Q1 performance and staffing and sickness trends. Before we get on to that, just go through some formalities. Connor, have we got any apologies, please?
Apologies from Councillors Hyler and Home, Little Brighouse, Benjamin Breeze, Elwyn Vaughan, Josie Ewing, Sandra Davis, Cabinet Member for Future Generations, Jack Straw, Chief Executive, Nina Davis, Director of Social Services and Housing, and Lynette Lavelle, Director of Education and Children.
Thank you. Has anyone got any declarations of interest on any of the agenda items today? No. Disclosure of party whips? No. Okay, so item 4, Q1 performance report. I'm going to introduce Officer Catherine James to talk us through the background to this report and introduce to the members of the public as well as this committee what this performance report's purpose is. And please, Catherine, as well, if you can give us just a high-level headlines of where you see the areas that need highlighting specific to adults and children's, please, rather than any other services. And welcome to committee. Over to you, Catherine.
Oh, thank you very much. Yeah, and I'm going to be supported by James Langridge Thomas, who's going to share his screen with you now. Welcome everybody. So before we look at the report itself, it's really important to raise awareness of the new scorecard. So as you can see on screen here, and there is a link to this in the agenda pack itself, but you can see a scorecard that supports the new corporate and strategic equality plan, which is called Stronger, Fairer, Greener. So there are 3 objectives to this. So you can see the first one here: we will improve people's awareness of services and how to access them. So looking at it, we've got an outcomes-based approach. So it looks at measures in terms of how much, how well, and what difference we're actually making. And it also moves on further down to look at what we've been doing during the quarter to support the objective. I suppose the important thing to note is that it brings together all of the services. So it's not siloed, it's an integrated approach that everybody's feeding into. And you can see here that it's not only what have we done, but it's what future actions are we going to be taking to support this objective, as well as what have we learned. So there's a lot of self-reflection here as well. So this scorecard is quite long, and it has a lot of detail in it, and hopefully the accompanying report will provide a more strategic overview. So further down here, as you can see, we've also got a high-level overview of the measures that support it, and as well as the actions, and it shows what does performance look like over time, which, as we're in the first quarter, we don't have any comparable information, but as we move through this year and further years of the plan, we'll have information here to show how we are doing over time. So it was really important really to give you a flavour of what this is like. So this is the first objective 1, and if James could just go up the screen a little. If anyone wants to look at objective 2 and 3, you can click on the left-hand panel, and you can also look at this in Welsh as well. It's important to note, so the Newid i'r Gymraeg button there, and you can so please feel free and let us know what you think of that. So moving on then to the actual report itself, which is in the agenda pack. The purpose of this report, which we provide every quarter, is to present our performance against our corporate and strategic equality plan. So the scorecard, as I've mentioned, is available in the agenda pack, but this is the first time that we've been reporting on the new corporate plan. There are 3 objectives. The first we just looked at then, as well as another 2. So this objective 2 is around supporting good quality, sustainable employment and providing training opportunities and pursuing the real living wage employer accreditation. And objective 3 is around working to tackle poverty and inequality to support the well-being of the people of Powys. So the plan contains all the priority work that we as a council have, and it's really driven by the Cabinet's work programme and ambitions. The objectives and measures integrate in there, as well as our corporate objectives, also bring in equality objectives. So we are doing all of that in one place. And the performance process that we've got in place helps us to evaluate what we've delivered, what's been learned, and to plan what actions can or should be taken to support our ongoing progress. So in terms of objective 1, in particular filtering in on health and care activity, the progress against this has been broadly positive as we've sought to improve how we work with people and communities. There are 3 measures allocated as off track. So the first is the percentage of children using intervention and prevention remaining with families safely. So the achievement was 89% against a target of 91%. The other measure off track slightly was the percentage accessing intervention and prevention that demonstrated positive progression. So the actual was 80% against a target of 88%. And finally, percentage of people reporting achieving their family goal through early help was 82% against a target of 90%. Although a significant percentage of children using intervention and prevention remained with their families safely, the percentage accessing intervention and prevention demonstrates a positive progression is slightly lower than the actual target. The number of children and their families stepped down to the early help service or to more specialist services like youth justice before they reached their goals. And similarly, the percentage of people that report achieving their family goal through early help is slightly lower than hoped for, but children's services will be reviewing the distance travel tool as well as the model of crisis intervention that is used. So, Chair, I don't know if you wanted me to pause there before moving on to objective 2, or would you prefer me to carry on?
I think if any members have got any questions specific to that objective, then yes, I would take those now, but it may be that they want to just, process and come back to that. So if we jump around a bit, that's going to be okay as well. I can see Councillor Gareth has got his hand up. Gareth? You're on mute.
Sorry. Yeah, just a general point, Chair. I can understand why we're using percentages, but on the one, there's a 9%, 8% gap between the target and the actual performance. But is that 8% of 10,000 or is it 8% of 100? It'd be good to, alongside this type of information, to have some actual raw figures. So if the 82% represented 12 children, as an example, we could then calculate what the target would be.
Yeah, I can see Catherine nodding. Is that something possible?
Yeah, no, we'll take that on board. Thank you, Gareth. Councillor Gareth.
I think just crack on, Catherine, but if members have got something that's really specific to the objective that you're talking about, then please stick your hand up, and then at an appropriate point I'll ask them to ask their question.
Okay, thank you. So objective 2 then, moving on, which is the one around sustainable employment and providing training opportunities. Progress against this objective has been positive as the council seeks to address the workforce challenges that face the county. However, there still remains a significant amount to do due to the challenging workforce situation, which is being experienced nationally. So the council supported a variety of degree schemes. Staff from social services were invited to apply to join the next cohort of the Grow Our Own social work scheme, which has been successful in strengthening the social care workforce and in enabling the appointment of 8 newly qualified social workers. Interviews started in social services in terms of degree sponsorship, which included 7 applicants from adults and 7 from children's services. And as well, council staff were eligible to apply to undertake a 1-year social work degree, for which there were 3 applicants at the time of reporting. There was an increase in attendance at the recruitment roadshows for children's services following a successful recruitment leaflet campaign for our in-house therapeutic home. And data about disability employment, both paid and voluntary, was reviewed to establish a baseline and start work on the Live Well Forum, which is a co-produced with the people of Powys to develop meaningful employment opportunities for adults with disabilities. There is now a better understanding of the financial stability of different organisations. However, it was acknowledged that further work was needed to determine who delivers accessible employment opportunities in Powys, how these are coordinated, and how this data is collected and used. Recipients of direct payments in relation to adult services received an uplift on their rate to facilitate the real living wage and the Financial Services Department identified the need to receive a real living wage. So the real living wage activity is an important ambition for the council to strengthen the county for the people of Powys by increasing fairness and supporting personal and economic resilience. So moving on to objective 3.
Oh, Councillor Gareth, do you want to ask a quick question on that?
Yeah, I think if I'm right, does the number of apprentices include schools?
Those apprentices there specifically were related to social services, but the whole report does include other areas.
But the 3 is for all services, is it? So you've got it. You haven't got it. Have you got this list broken down into children's and adults? So is this for the whole?
But it was were eligible. So it says all council staff were eligible to apply to undertake the 1-year social work degree.
Yeah, no, it's specifically the apprentices I'm thinking about, because to only have 3 starts of apprentices across a workforce of 5,000 is not very good in my mind.
So do we know which departments those apprentices were for? Are we where's that information, Gareth? The 3 apprentices?
Well, it's how much on that screen now, number of new apprentices within the council.
So that could be in any department, right, yeah. Catherine? Yeah.
Yes.
But would we even have apprentices in children's or adults? Or I don't know if that's a type of work force type for us.
Yeah, well, in another life, I support apprentices doing a level 7 apprenticeship in accountancy.
Yeah, but what I'm saying is in children's and adults, yeah, would we have those?
Yeah, I understand that, but but I'm thinking of the whole council now. To only have 3 new apprentices in the first quarter, and the council's paying a fee through the apprenticeship levy for that. So.
No, I get the point you're making, but because you're talking at the whole council level, yeah. I'm then asking it so that we do our scrutiny. Does that apply to each of any of our services that we're looking at? Rachel?
Yeah, so in childcare settings, we've got 8 in total. So I'm wondering whether this performance report card is only applicable to new ones within this quarter, and not necessarily the total.
Can that be taken back in
same number of no?
Yeah, that's right.
Okay. Yeah, I guess one of the issues here then is, Catherine, as you said just now, is as it goes forward, we'll be able to see how this changes and develops on each quarter.
Yeah.
But perhaps this does need to show the total number of apprentices within the council that are current apprentices.
Okay.
Yeah. Okay. Right. Sorry. Carry on.
Okay. So moving on to objective 3 then, which is around tackling poverty and inequality. Progress against this objective has been positive, despite the challenging socio-economic backdrop. An accommodation tracking form was developed by Adult Services to provide intelligence on future accommodation needs of individuals with a disability. And this has resulted in the identification of a potential need in a specific area of the county, which can now be investigated. Care Inspectorate Wales registration was gained for an in-house residential provision in South Powys, offering 2 additional child residential placements, and a further 3 additional places became operational for those children aged 16 plus in Mid Powys. And a new partnership was formed between the council's Preventative and Restorative Justice team and Freedom Leisure to support families in accessing facilities in the Llandrindod-Wells area as part of the Turnaround project. And this contributes to creating a stronger Powys where communities succeed together and are personally resilient. And before I finish, it's just important to note that we have provided some example questions in the agenda pack, if they may be useful.
That's great. Thank you, Catherine. Just before we come on to questions from members, just for the public's awareness, we've discussed some of this behind the scenes, and as a committee, we have decided that we're going to be making an overarching comment that going forward, as we come to use this tool and look at the council's performance against these quarterly corporate and strategic objectives, that we need to be provided with the monthly operational performance data and KPI reports that are generated for each service, because that will enable us to dig down into some of these objectives and the progress and ask more targeted scrutiny questions. So as a recommendation, and Gareth, please, if you could make a note of the recommendations, that is what we're going to ask for going forward for next time this comes back to committee. Councillor Liz.
Thanks. Just a question for Catherine on the last slide. It mentioned the amount of rental income lost, and it said the amount and percentage. Is the amount somewhere then? Can we find that? It's just got a percentage there, 3.882%, was it? Something like that.
I haven't got, I can't look, I can look for you to see whether it should be in the detail below, but I don't know off the top of my head, sorry, Councillor Liz.
Yeah, thank you.
Anyone else got questions? I've just got a quick question. Oh, sorry, Chris, I've seen your hands just pop up. Let me just ask mine quickly because I didn't see it. When you mentioned about the new partnership being formed between the preventative and restorative justice team and Freedom Leisure to support families, do we have any information on why that is specific to Llandr and Dodwell Wells area, and whether or not there's been any work done to look about whether or not that would be suitable in other areas, other parts of Paris and other areas where we have Freedom Leisure operating? And is that something you're able to answer?
No, sorry, I don't have further information on that, but we can request that that's asked for by the service.
Councillor Chris.
Yeah, it's rather than a question, it's more of a comment. I mean, I think we're at very early days with this new presentation of the performance information that we're getting. So I think I can certainly see the potentials there. I do welcome the commentary aspect to it, and that does help us to give context and understanding. But I think with just having one quarter in there, it makes it difficult to be able to make any sweeping statements in relation to where the trend is at that point in time. But I think it's got some potential to move this forward so that we have better insight to these corporate objectives moving forward.
Thank you, Chris. Councillor Gareth. Oh, you're on mute, Gareth.
Sorry, Chair. Yeah, I've just gone back to the report, and perhaps this is a question for one of the Sharons. I noticed under 2.1 there's 3 measures that we're underperforming against. And I'm just wondering what actions the service has taken to try and bring them back against the target. The first one was percentage children using intervention prevention in Maine. So it's 89% against 91, and there's 2 others that are even further away from the target.
Thank you, Gareth. I think just to add to that, that's one of the reasons why we've asked for the performance operational data that sits behind this, because it may be that some of the more sort of service specific details that would link in with this would give us a better picture on this, and that's the reasoning why we've asked for it. But if there is anything that Sharon is able to divulge, that would be helpful, please. Thanks. Hi, Sharon.
Hi.
Welcome to committee.
Chair. Thank you, Councillor Jenner. Thanks, Chair, and thanks, Councillor Jones, for the question. I think Catherine touched on some of the narrative in in terms of when she went through the objectives, but just to kind of go forth with some further narrative for you. So it's what we found is we're trying to kind of look at the number of children, and completely take your point about the percentage as well too, in terms of having that as numbers as well as an overall percentage. So in looking at that percentage, we have found that actually when we're measuring it, sometimes that intervention for that particular child and family doesn't potentially end within the intervention and prevention service. Sometimes those families go on or step down into the early help team, and sometimes those families also kind of receive intervention from the youth justice team. So this is a new percentage for us too. So we're looking to navigate around that as well. So it's not necessarily, although it looks like a deficit here and it is reported as a deficit, it doesn't mean to say that those children and families didn't have an intervention from another area of children's services. What we haven't done is captured how many and where and what was that impact in terms of the data here, which I think would be helpful for yourselves in terms of that further narrative. So I hope that kind of goes some way to answering that question. It's more about when we capture the data, not the journey for the child within different service areas, if that makes sense.
Okay, it does. And do you think you've actually set yourselves some very challenging targets as well?
I think potentially looking at it at the end of Q1, you know, we're always striving to meet our targets. And that's really, really important. So I think we need to do a little bit of analysis on that in terms of how we're reporting it, so that it isn't reporting as a deficit if actually the deficit isn't there, if that makes sense, because the family's still receiving that intervention. So yeah, I agree. We need to reflect on that and review, and it's a really fair question.
Thank you.
Yeah. Thanks both. And I think, Sharon, if you can ask who needs to be asked, whether we can have the most up-to-date children's performance reports on our team's channels as soon as possible, whilst this is all fresh in our minds, then what myself and the committee can do is have a look at that. And if there's anything that we'd like to follow up with that is still a question, then we can put that in writing as a committee. So I'll ask that as an action point, please.
Yeah, no, absolutely, Chair. That's absolutely fine. I mean, we're still collating just for assurance for the committee, we still collate our monthly performance data, and we're still gathering all our Q1 data. So we absolutely do have those reports, absolutely can share them with you. And
we've only got up to April's. I've got adults up until July, so I think it's just not made its way onto our channels. So hopefully that can be addressed.
Yeah, we can address that, not a problem.
Councillor Liz.
Thank you. Sharon, I know there was mention of WSIS in the report and the connectivity. I know there's a lot of work going on with it, but I just wondered whether or not you have any concerns about it having an impact on performance, on the reporting, you know, the extraction of data, for example, and feeding that into the reports that are being produced.
Yeah, it's a really good question, Councillor Liz. Whilst there are complications with WSIS as a system, in terms of it is a system that we're planning to kind of replace in the future, we recognise actually it's got constraints in terms of how we want to utilise that as a service. It isn't impacting necessarily on the data that you've actually had in this particular Q1 objective and measure report in terms of that.
And have you got any concerns in relation to it and the management of risk?
I don't have any concerns in terms of management of risk. If there are any complications with the system, whether that's on an hourly or a daily basis or weekly basis, all of that information is kind of well cited on, and that I'm actually well cited on when there are any potential problems with the system actually not being available, as an example. It doesn't directly impact on risk, it is the system, so it's practice and children are seen and interventions still happen regardless of the system. Where there is sometimes a complication is recording that information in a more timely way if the system isn't available, but it doesn't have a direct impact on risk. We're completely sighted on when the system is available, it isn't available, and I have oversight of that all of the time, so it can provide you with assurance that actually it doesn't impact in terms of risk necessarily.
Thank you very much.
Can I just ask a question on that as well? What about impact in relation to Objective 2, supporting the workforce? When the system is down, I imagine it can be very stressful and frustrating. It can take staff much longer to do what they need to do. And I know we're coming on to looking at staff levels of sickness, and that's a separate sort of area. But what's the impact of WCIS on the workforce at the moment? Has it improved, or is it still on and off a cause for concern?
I mean, we regularly kind of engage with the workforce through either individually or through our road shows. And WCIS is always a subject that comes up in terms of staff's kind of frustrations around it. It's been less problematic, I have to say, over recent weeks and months, which is good news. But again, it is quite a clunky system. And it definitely is an area that we're striving to improve on and replace and work towards something that actually is a much easier system to navigate around. It doesn't come without its frustrations. So if you did speak to a staff member, I would say that is one thing that actually does still continue to cause frustrations, particularly when it's not available at key time points when a social worker or a worker wants to input information. So the frustration comes from that. They're having to record information on Word documents, could then input that at a later stage. So that's when that becomes frustrating for workers. So yeah, it remains a frustration, but it's something that we're very aware of. It's something that we work with. We do have designated data quality clerks that sit within children's services, and they very much monitor all of that. We also have coordinators that work in teams that help social workers become less frustrated when the system isn't available for them when they need to use it. So we've got a number of mechanisms to kind of work with the staff in terms of those areas which cause them unnecessary frustration.
So are those data quality clerks and the other people that sit within the teams, are they able to help social workers input the data they need to, so that then their capacity isn't overly affected?
Yeah, absolutely, Chair. So their roles are very specific around data collection, inputting on the system, and supporting the workforce to kind of go out and do the practice, while they then can kind of put that information onto the system, if that system isn't available at that time.
Great. Deal. Thanks for that. Councillor Chris.
Yeah, I mean, I was going to pick up the same point around the workload with a qualified social worker, just data inputting. So I'm glad that's been resolved. My recollection is that we were informed that WCIS was going to be replaced, and there were some other systems being considered. And I think this is going back to around about April time. We're told that was going to be presented to us at a future scrutiny in a few months' time. That was my recollection, but I've not seen or heard anything since.
Can I just double check with the officers that we're not straying into anything that's commercially confidential here? I'm just thinking of, I know WCIS is a contractual thing. I'm slightly wary of this.
Yeah, I think you're right to be wary, Chair. There are conversations that are going to be happening, but we can't report anything back as yet.
Okay, perhaps we can have a written update in due course, and we've been provided with such updates previously confidentially, and I'm happy to receive those confidentially in due course if you think it's appropriate. But yeah, thanks, Chris, for that. Okay. Any councillors, any other questions on this other agenda item? Can't see any hands. I've lost my participants bar, but I can't see any hands up. Let me just double check that. No, that's great. Well, thank you so much, Catherine and James, for bringing that to us today. And we will look forward to seeing how how this can be used going forward with this committee, and how we can develop the committee's purpose in improving the scrutiny for around these objectives. So we will do some thinking and as to how we can put our recommendations in place behind the scenes. So thank you for that. Right, so the next agenda item, item number 5, is staffing, sickness and trends. Just for members of the public to be aware, we as a committee have got some information that we've been provided with, which is in a report format, which isn't on the public website link. We are of the view that there's nothing in here which is confidential, and so we are going to carry on in public session, and I'm going to introduce Sharon and Councillor Shan to take us through this. And what I'd like, if you can, I don't know if you want to share your screens with the reports that we have had or not, but if you're able to give us your, rather than take us through absolutely everything in these reports, if you can take us through the key themes, where you see there are trends within each of your services in terms of sickness, whether or not you have the information to give us an overview of whether those trends are what you would expect, how they compare with other service areas, sickness levels. If you don't have that, then to date, at the moment to hand, sorry, please say, that's fine. But I'm sure we'll be asking questions in those areas. But what I'll do is I'll hand over to you. Shan, are you introducing this? Or you?
No,
just
I'm sorry,
I've
got no preparation at all.
Okay, that's absolutely fine. But I will hand over to Sharon and Sharon. I don't know which Sharon wants to take this first, so I'll leave that for you to decide. And over to you.
Sharon, do you want to go first?
I'm happy either way.
And members, what we'll do is we'll let Sharon give an overview of this, and then we'll leave questions to a chunk at the end.
Okay.
Over to you, Sharon.
So
I'll let Sharon go first.
So hi everybody, Sharon Fruin, Head of Service for Adult Services. I will share my screen now. Can everybody see that? Yes.
Yes, thank you.
And I will just take you through the highlights. So this is for Q1, so that's April to the end of June, and starting off with the percentage of the workforce absent and how it compares with the rest of the authority. You'll see the current absence rate across Paris is just under 22%, and in adult services we've got an absence rate of 25.5%. It doesn't come as any surprise to me. That's sort of where I think it would be. In fact, I think it's closer to the council average than I would have expected. One of the reasons for the increased absence rate may be because frontline workers are directly involved with citizens, and if they're ill, can't work from home because they have to be in direct contact. The rest of the report goes into breaking it down into long-term absence for the quarter. You'll see that the month on month we've seen a significant reduction in the number of staff absent. So 27 in April, 24 in May and 19 in June. This has been through quite robust HR support and officers managing through the sickness absence policy, and supporting people either to return to work or actually finishing on ill health. The short-term absence statistics in April, we had 2 employees who hit the trigger for support through the absence policy. In May it was 2 and in June it was 3, and overall this is the comparison from Q1 to the previous Q4, and you'll see a significant reduction in the long-term and short-term absences across the service, which is really good news. Obviously, the more people we have in work, the more services we can provide. But that has really been through real quite dedication of the managers in managing the process. The reasons, there are many reasons, but significantly you'll see those peaks, and the most common reason being around stomach, liver, gastro illnesses, which account for 26 occurrences in the quarter, then 23 occurrences for infections and colds. And as you can appreciate, we have to follow policy, and staff actually cannot come into the workplace if they're experiencing symptoms of gastro, and obviously with them, especially in the current climate around respiratory infections, we're very cautious about infection control. And the third highest are the 19 occurrences of sickness due to stress and depression. But important to note there that they're classed as non-work related, those stress and depression. The number of occurrences over the previous 6 months, we're
sorry,
also...
say that last bit again, Sharon, in terms of the non-work related bits, sorry.
They've been categorized as stress and depression and anxiety, but not related to work.
Okay.
So they'll be personal issues or
Okay.
long-term conditions. The number of occurrences over the previous 6 months are there for you to see, again with the downward trend, and we've seen a significant decrease in the amount of working days lost. So just to recap, Q1 has seen a reduction in both occurrences and working days lost. The number of staff absence due to long-term sickness has fallen each month, and it continues to be a significant priority for managers to manage this, both for the well-being of the individual staff members, but also because of the impact it has on our ability to deliver services. Staff are supported by our HR advisors. They've delivered 121 training sessions and support sessions for the quarter to guide managers through the process. But capacity to carry out this level of work does have an impact. Are you happy for me to move on to the workforce data?
Yes, I'm just checking. I can't see. Yeah, I think we'll leave questions to the end, Gareth, and then wrap them up there. So, but you feel free to keep your hand up if you want. Yeah, carry on, please, Sharon.
Very brief summary of our workforce data. There's a month-on-month table there for you to see how many full-time equivalents, how many people started and how many people left the authority from our service, broken down into fixed term, agency and the number of apprentices. And you'll see that during Q1 there's been 10 leavers, which is a significant reduction to Q4, which we saw 16 employees leave our service. And there has been a significant reduction in the numbers of qualified staff leaving through this quarter. In fact, there was no qualified leavers in Q1 compared to 12.5% of the leavers in Q4 being of qualified staff. Exit interviews are conducted and offered to all service leavers, and the information is fed back to our HR colleagues and SMT for us to consider any trends and any reasons and themes for reasons for leaving the authority, and anything we can do to stop people leaving and to support people to stay. And we're at a neutral position, so we've had 10 leavers and 10 starters.
Okay, great. And is that the end of?
Yes, it is. Yes.
Yeah,
Shall I stop sharing?
Yes, please. Yeah, thank you. We have got those on our Teams channel if any members want to go back and have a look. Sorry, Sharon, you're going to be put in the deep end, because I imagine some of the questions that we're going to ask are going to equally apply to children's, and so Sharon Powell will get the heads up of what we're going to ask. I
will do my best.
But just a quick question from me before I come on to the other committee members. You mentioned about the 19 stress-related occurrences being non-work related. Where would it be captured if it was work-related?
It would also be in those reasons. In that sickness occurrence, it should still be there. There's two classifications: work related and non-work related.
Okay, because on there the total number is 19, isn't it?
There's one is 19 and one is 5.
Oh, okay. Hang on, I've missed the 5. Oh, yes, I see. So that's the column after the 19.
Yeah.
Right. Okay. That's the work-related one. Okay. Thank you. That's my question. Right. Councillor Gareth, you had your hand up first.
Yeah, thank you, Chair. And first, can I say congratulations on managing the level of sickness downwards. I think that's to be really good. Just on the first table, I found that a little bit confusing when you said the sickness rate was 25%. It's actually 25% of the staff has had a period of sickness in that quarter. And when you do the working days lost against the FTE, it comes out as a much higher figure than across the county council. So perhaps we could do that with a percentage of the percentage of the working days that's lost rather than the percentage absence.
Okay,
absolutely. Just as a suggestion. Linked to that, do you have any idea of how that improvement in sickness is actually affected on the budget? Has it resulted in less agency staff being employed, or is just?
We've actually got more agency staff employed because we've had additional money through different streams through for transformation. So we tend, yes. So I would have to unpick that further to see exactly how much we've added to the budget because we've had additional funding.
But but there's still more staff time being spent with clients,
absolutely,
families, etc. Yeah.
Can we capture that as a question, Connor, please, that we want to revisit when we come to look at the quarterly finance performance, because it might be worth us seeing whether we can get that information at a later date.
Yes, Chair, I'll make a note.
Thank you. Anything else, Councillor Gareth?
No, that's fine. Thank you, Chair.
Thank you.
Councillor Edwin.
Yes, thank you, Chair. It's the question really, how do those figures compare with pre-COVID on there, especially on the stress and sickness?
I'm sorry, Councillor Edwin, I don't have that detail to hand, and I was not in authority when during COVID. I don't know if either of my colleagues of any kind of memory of what that was previously.
Yeah, I was just trying to relate sometimes, because there seems to be grumblings about, whether or not there should be more officers back in situ in offices as well, rather than working from home.
Okay.
And then it was brought up in a council meeting actually, where we were given a presentation of a work-life balance, whereas people have been finding that since COVID, many have taken the decision that just, shall we say, one partner would continue to work and the other one would not. And they look at the significant reductions in costs, i.e. one car less, whatever it may be, but just to get that work-life balance back. And I'm seeing it in other places as well. It seems to be affecting it quite a bit, really. I was just wondering whether we'd, been reflected with you.
Also, Sharon, we've discussed as a committee whether or not we think it's worth delving into whether or not people are feeling more work-related anxiety and stress because they're not seeing colleagues just for camaraderie, if that's the right word, as regularly. And just, I know myself from having a look at the monthly performance data that supervisions are okay. So it's not that people are not knowing what they're doing and feeling stressed because of that, but it's whether or not there's a trend of people feeling isolated and not sharing their worries, and whether we can unpick that going forward.
Just to offer some reassurance, we've held numerous roadshows, as I know you're aware of, and it's a topic we discuss quite often in our team meetings. And there's a real mixture. A lot of staff have said that some of the things that they don't want to lose is the balance of being able to work from home. And some staff are saying they want they are enjoying coming back into the workplace and having those face-to-face contacts. So we've taken a decision that supervisions and team meetings, and especially team meetings, should be face-to-face. That that people are expected to be in the workplace, during the week, on agreed days, and it's as you've alluded to, it is striking that work-life balance. We do have a process around people being able to work flexibly, and I don't think we've seen an increase in those requests to reduce or condense hours, but we do see a steady trickle of those coming through, usually as people's lives change personally, and we respond to those appropriately, supporting where we can, but obviously making sure we can still deliver services as our priority.
I think also under that sort of theme of pre-COVID and post-COVID, it's worth keeping an eye on any trends on those in the workforce that can work from home all the time, and they don't have to be client facing, because you can carry on working from home when you're unwell, and you might have a stomach bug or COVID. I know I tried to work through having COVID,
yeah.
And I made myself work, and I'm sure other people would have experienced similar, and I ended up being iller for longer. And whereas if I couldn't work from home, I would have taken 2 to 3, 4 days off and got better, and then been back, at 100%. And if that's not watched if there's lots of people doing that, then there could be a risk of people then getting burnout, and because they're under the weather.
Absolutely agreed,
so,
Claire. We do have those conversations.
Good.
Absolutely, about should you really be in work, even though you can work from home, you should be resting.
Yeah, you shouldn't be working from home even though you can.
Yeah,
so,
absolutely.
And then it's managing that with and I imagine it's unlikely, but you want to monitor that is everything's genuine, and because you will get the odd, very, very odd occasion where it may not be. Rachel, did you want to come in on this point?
Yeah, I was just going to actually reiterate those very points. Certainly around the road shows are a really great opportunity to have staff come together to understand what works well, what they're worried about, and to really understand some of the big ideas. And some of the key messages that were coming from that is the need to have a balance between having that flexibility to be able to work from home and be able to have that work-life balance, but also have the opportunity to come together face-to-face with colleagues, to be able to share some of the problems and to be able to work through things on a different level. And having that face-to-face conversation offers a really different dynamic. In addition to that, we also have what's called the well-being protocol. And we are constantly reiterating that to staff, because we recognise that there are lots of staff in lots of different roles. And certainly those who are working more from home, we, in a way, need to absolutely reiterate that protocol even more. So things like, keeping your Fridays free, so not necessarily having meetings from, completely bombarding your day, making sure that staff have protected lunch breaks, so they're not booking meetings through their lunch hour, and making sure that staff take time away from their screens in order to take some downtime, be able to reflect and be able to get some exercise. So that well-being protocol, we try and reinforce through our supervisions and one-to-ones, as well as through our team meetings. I think the point you make around some of the roles that are not as face-to-face as some of the frontline roles is a really important one. And that's certainly one that we've picked up through our commissioning team, where some of those roles tend to be less face-to-face and less operational. And we have seen patterns where, staff are unwell and yet feel that they can work through that, and that's longer term can have a far detrimental effect. So we certainly picked up on that and having individual conversations with staff around the need to make sure that if you're unwell, that you take time to recuperate. And otherwise there could be longer term detrimental effects. So just wanted to support those points and provide assurance that we have picked up on some of those some of those trends and some of those nuances, and are having some of those conversations.
Great, thanks, Rachel. Councillor Liz, is your question specific to adults, or is it going to be one that you're going to want to ask to Sharon Powell as well? You're on mute.
Yeah, and I was going to say, actually, I've got 2 questions and they apply to both. I'm sure they will.
What I think we should do is let Sharon Powell come in and do hers, because I know I've got a couple of other questions as well that again equally apply to both.
Yeah.
And we don't want to be repeating.
No, that makes sense, Chair.
So at this stage, please hold your question ready, Councillor Liz. I'm going to hand over to Sharon Powell, if that's okay, please.
Yeah, thank you, Chair. Connor, could you kindly share the report for me?
Yes, just give me 1 second. Should be coming up on your screen now.
Okay, thank you. Okay, so thank you, Chair. So in terms of children's sickness, we've kind of presented ours in a slightly different way to Sharon and adult services, but nevertheless, the information is going to be very similar in terms of what we've gathered. So you can see from the screen in terms of sickness trends, and ours relate back more on a month-by-month basis rather than a quarterly basis. So you can kind of see in terms that full-time equivalent posts, how much actual sickness is actually undertaken. And you can see that that has kind of dipped and then increased over the winter, and then dipped again in the spring, right the way through into June in terms of that. So in terms of our sickness reporting, we work very closely with our HR department. They provide us with monthly sickness reports, and that information is looked at and scrutinised in terms of not only the individual staff member who might be off sick for 1 day or 2 days. We look at long-term sickness. We also look at trends in terms of individuals, and we also look at trends within teams, and we also look at trends within service areas. So whilst we can't provide that specific data for you today, it's just to provide you the assurance, because our numbers are very small in terms of sickness, that we do actually every month look at the details that surround all of that information, all of that data, kind of drill down to actually what are we doing, how can we best support our workforce in terms of returning to work, what are the complicating factors and particular trends with a particular individual or with a particular team or service area, so that we can then map out, do we need to actually think about and reflect upon and do something different. So if you could take it down slightly, Connor, for me, that would be helpful. So in terms of long-term sickness absence, you can see that as of end of June, there were 8 members of staff who were on long-term sickness, and none of those actually met the requirements for any particular HR intervention or HR support at that time. So we're very much looking at things from a support-based perspective. We very much want to work with staff, promote well-being, work with them on whatever those complicating factors are. And you can see that there's some data just sitting underneath that say that 10 employees were recorded on long-term absence during June. In terms of short-term sickness absence, we've got some kind of monthly figures there. So you can see from April, there were 32, that kind of reduced to 25, goes back up to 34 in June. And we're kind of seeing that kind of trend as the kind of trend in terms of what we've got in terms of numbers. And if you could take us down a little bit, Connor, that will kind of show some of the more detail in terms of the reasons around that. So again, like Sharon explained, we kind of look at all those individual circumstances for sickness and the ways in which it's kind of categorized. These are the ways in which HR collate that information. So again, there are things on the left, that hand side, that, you know, it could be treatment, it could be a medical appointment. It does say about stress, depression, anxiety, mental health in terms of that. Some of that, as Sharon mentioned, is non-work related and work related. And just on that point, I think sometimes, although we categorize it like that, you kind of we trying to look at it as an overarching theme in terms of how do you actually differentiate between somebody that's experiencing mental health as a result of work-related stress, but also they might have underlying mental health difficulties. And sometimes it's difficult to actually separate that out and say that's personal or that's work. So we tend to look at that as a whole and kind of think about, yes, if there's something acutely aware and it's stress-related illness to do with work, we look at that, but then we look at also the themes and trends around the whole kind of concept of well-being within that as well, just to look at, is there anything we can do differently? Rachel touched on Care First. There's a whole programme of support that sits within Care First, from individual counselling sessions to occupational health assessments. It could be a shorter piece of intervention where we commission something specifically for a specific reason, as a result of a particular difficulty that a staff member might have. So we've got a wide range of options that we can draw upon to actually support staff depending on what those difficulties are. You can see that some of the higher figures there are self-explanatory, particularly around pregnancy-related absences, that being one of the higher trends with stress, depression and treatment and tests at the top. And then we come down, that was for June. And then if you look in comparison to May, it's fairly similar really in terms of the trends. The top one seems to be the highest tick box one that people relate to, and that's about treatments, medical appointments, etc. What we have found as a result of post-pandemic, you'll remember that actually during the pandemic, lots of health service appointments were actually kind of not available, that lots of services were actually restricted. So for those staff, I'm not surprised that the appointment medical one has gone up, because this is where staff are now catching up on those, whether they're routine appointments or whether it's for more specialist intervention. That goes really in line with the NHS opening their doors wider really to those services getting back to normal. So I'm not particularly worried that that particular line is higher than the others. If we come back down, Connor, that'd be helpful. So again, we're just giving you some kind of data around the same trends really for April, May and June. And like I said, they're pretty much kind of similar. You can see that actually COVID is still being recorded. We're still recording that. And particularly in April, we had a spike in terms of that. Right now, I'm aware that COVID is more prevalent in our local communities. And as we head into the winter months, that is definitely something both Sharon, I would imagine, and myself are going to be kind of keeping a really close eye on in terms of the impact of that in terms of the work we do. So if we come down to the number of occurrences over previous 12 months, you will see from there in terms of, we kind of map it in terms of if it's a one-off occurrence of sickness, if it's twice in terms of 12 months, and then if it's 3 times in 12 months. And that kind of tells you there in terms of the number of employees over the previous 12 months. For twice being absent was 54, and for 3 times being absent, that was 45. And then the employers who reached the target of 2 in June was 8, and 3 in June was 12. So that does say that, I guess, from those number of occurrences, that is going up for some members of staff. And that's where we then look at the finer detail in terms of drilling down again, because the numbers are relatively small in terms of being able to identify individuals within service teams and looking at actually what service do we need to think about or do differently for those particular staff. The narrative underneath just indicates a little bit more detail then in terms of 54 staff have been absent twice in the previous 12 months. 8 of those had had their second absence in June. So what that's saying is 54 staff had been absent at least once in the previous 12 months. And then June, 8 of those reached their second absence. So again, it's not a high percentage in terms of the number of full-time equivalents, but nevertheless, it's really important for us to monitor that and to consider consider that and to reflect on what do we need to do differently in order to support the staff. And again, there's 45 employees who've been absent for 3 or more times in the last 12 months, and 12 had their 3rd or highest absence in June. So again, it allows us to kind of really look at those individuals and to make sure that they're getting absolutely the right support that they need in terms of whatever their complicating factor is, but also looking at employment in terms of additional support or any advice we can give to guide them to come back to work. So if you scroll down, Connor. And then we come, we've presented our starter and leaver rates in a graph like this. You can track it back right to June 2022 in terms of leavers and starters. And you can see that in June, July, August of 2022, there was quite a kind of trend, an upward trend of spiking to August 2022 in terms of leavers. And then you can see that it's kind of come down, gone up slightly, and then kind of come down and then gone up a little bit. Again, those numbers are relatively small in terms of those rates, but if you look and compare to actually the starter rates, whilst they were lower in terms of starters and leavers in June, July, August, then you can see that from September onwards, they've kind of peaked, dropped a bit, gone up, and then really gone up and stayed up. So that's really where, in terms of correlation for that, there's that the back end of Q3 into Q4, you will have heard me talk about our recruitment drive. You will hear me talk about our real energy that we put into our residential homes, and that how we did things in a slightly different way to recruit members of staff into those residential homes. And that's absolutely correlates with the spike that you see in March in terms of those residential home workers actually coming then into post following that recruitment drive that was held in December, January. So it's pleasing that actually our leaver rates is kind of sort of on a downward trajectory apart from June, but what it mirrors is our starter rates are absolutely increasing. So that's, really good news for us. We've invested a lot of time and energy into recruitment, and we're also looking and investing a lot of time into retention. And one of the things that we've reflected on as a whole in children's services is looking at the nature of the work that we do. It's looking at the resilience levels in the nature of the work that we do, and looking at how can we promote and kind of a real sort of culture of openness, of learning, of transparency, about looking at how we can kind of develop our staff in different ways, because the staff is our greatest resource in terms of children's services, and it's absolutely part of our integrated business plan in terms of our key objective. And one of the things that we've reflected upon is well-being as a whole. And whilst Care First is a really good option in terms of accessing lots of different information, we've also found that we need to develop different ways of promoting well-being within the service. So we've got an in-house psychologist who's actually been working really closely with myself, and he's been devising different types and styles of reflective practice, reflective interventions, and we're looking actually now in Q3 to develop some techniques that we've actually purchased as a whole, and there's a technique that's actually the NHS have used, and we're looking to put that into practice here. What it means in essence is having debriefing sessions with staff who have really difficult conversations most of the time in terms of the work they do, building that in so that people can have an opportunity to reflect on those difficult conversations, not only in their individual supervision, but in that peer reflective space where they can get together, they can kind of reflect together as a group. There'll be a facilitator that's attached to that group who can then explore with them and ensure that they can ventilate whatever it is, and they can kind of get the support from their peers in a safe space. And that hope that we're in this together, we're a very supportive environment, and we want to work with whatever those tricky situations are. I mean, it is worth noting that actually the work has been highlighted by Social Care Wales, and we've actually been invited to attend the Assistant Directors of Social Care Conference in October to actually share the good work that we're doing. So I'm really, really pleased and excited about that. And I think it's really good that we're getting that recognition that actually we're changing the environment of how we're working, because the work remains the work, but it's about creating that culture of that safe space and that environment where it wraps around the service to kind of support staff to build the resilience. So I'm hoping For the future, our starters go up and our levers come down, but it takes us on to our last slide around agency workers. And you will see, and you know, that we've had a high percentage of agency workers that have been in children's services over a number of years. And you can see the graph where it's peaked and come down, and then it's hovering around that sort of 28 to 29, 30 kind of mark. Our aim, absolutely, through our Grow Our Own programme, is to continue to further reduce the number of agency workers we have in the service. And that's not to say that agency workers are not valuable. They absolutely are valuable. They absolutely have a role to play. But for me, it's about creating stability, it's about creating security. It's about creating that permanency within the workforce so that we can be more effective and more efficient in the work that we do. So it's really important that that goes on a downward trajectory. We heard earlier from Catherine about the number of Grow Our Own social workers that are coming in to the service. We have 8 newly qualified social workers who are in post, who are due to qualify now in November. We've also recruited 2 external newly qualified social workers who've come from other local authorities to begin their journey here. So that's really important. And we've also developed a master's programme where we've had 2 who've qualified recently with Cardiff University that are coming into our service. So our next steps are safely managing those workers coming into the service, and then managing those agency workers, or some of them, exiting out of the service. It's not without its challenge, because you have to balance needs, risk, the service, etc., in terms of what we do that. But absolutely, that's the trajectory and what we're going. What we're finding over the last sort of 2 quarters is really we've had more agency workers who are interested in actually converting to become permanent members of staff. So that's really good news. We send out fortnightly bulletins in terms of updates about recruitment, retention, compliments, any good news stories. So that also sends the message really to agency workers that where they can see that those vacancy rates are lessening, they're kind of then thinking, actually, do we want to be a part of this as a service? So some of them are actually transferring into permanent roles, which is really good news. So like I said, it's not underestimating the role of an agency worker at all. They're really, really important to us, and they really need we really need them in order to promote the services that we're providing. But it is about sustainability, and that's certainly looking at the financial envelope. We absolutely need a downward trajectory for our agency workers. So in terms of summary, that's the kind of area in terms of Grow Our Own, which we're looking to strive to develop. We're absolutely committed to supporting our staff, and we're absolutely committed to kind of looking at well-being in a holistic way, and kind of looking at what we can further strengthen to support our staff to be the best that they can be in the jobs that they do. So thank you for that.
Thanks, Sharon. I know members are going to have questions. So please, members, start putting your hand up. I'm just going to ask a couple of sort of overarching questions, really. Firstly, what's the process when someone is sick? How do they make that known to their team leaders? Do they have to make a phone call? Is it an email, or do they not have to do anything? As part of that question, what is the time period that they're allowed to self-certify for? Has that changed? I know in some employers have changed that since the pandemic. It's because of you can't speak to a doctor to get a note, so it's increased. So that's another question, whether that's changed. And also, when people do phone in or email in and say why they're ill, and you find out what it is, or when they come back and they have to fill in that form, if they put down, for example, gastro, stomach related, at what stage would you look to dig deeper into whether that is an infection, food poisoning, or could actually be a physical illness that's caused by a mental stress, because of IBS, and even migraines and back and neck problems can be caused by well-being and mental health issues. So those just some overarching questions for you to just whilst other councillors get their thoughts together.
No, absolutely, Chair. So this will apply to to Sharon as well in adult services. So there is a sickness policy, and there are expectations with that in that policy around the areas of the questions you've put forward. So the steps are that you have to have a conversation. So if I was ill tomorrow, I would need to, Saturday tomorrow, but if I was ill on Monday, I'd need to speak to Lynette and go, look, I'm really poorly, I'm not in today, this is the reasons why. And so that can get recorded from that point in terms of that conversation. It's really important to have the conversation because it's about checking on that person's individual well-being, but it's also really starts you thinking then in terms of that person's individual health and well-being from that point as their supervisor and manager. So that's definitely the kind of policy. And then you can self-certify for up to 7 days. So that hasn't changed for us in terms of social care. So you can self-certify for up to 7 days. And then at any point when you return to work, whether that's the next day or after the 7 days or after a month if you've been off ill, depending on whatever the circumstances are, we have a return to work interview, and that is recorded by the supervisor of the individual staff. So it's a process whereby you would have a conversation, you try and understand what the reasons were that you were off poorly, that gets recorded, and then that gets signed off. And again, that's how you measure then when someone is off, maybe on those reoccurrences that we provided in the data. So for example, if there were then some reoccurring themes, you might then begin to have those conversations about maybe an occupational health assessment or some counselling sessions or whatever. It could be anything, or just general advice around for that individual. If there were reoccurring differences, again, it's a way of just understanding that cumulative effect of that and the impact of those times you're off sick on multiple occasions, and what's the kind of correlation around that. So that's where supervision is really important in terms of understanding your staff and their well-being matters, but also that return to work interview is a really formal process of actually recorded and signing that off. And it also gives an opportunity around talking about support. What support would you like? Could you have? Do you need it? Or was it, like you say, a gastro bug that kind of just came and went, etc.
Okay, great.
Can I just
Thank you.
add, Chair, that throughout that process, we would make regular contact with the person if it was a long-term absence. So whether that be weekly, but certainly no less frequently than fortnightly. And we'd be constantly discussing ways in which we could support them back to work around reasonable adjustments and giving them advice around where to seek support on particular issues.
Yeah, thanks, Sharon.
Thank you both. Councillor Gareth.
Yeah, mine's a very quick question to Sharon, and a request more than a question, I think. For Sharon on adult services, we had the number of head count FTE equivalents. I wonder, could that be put on future reports so we can just do that judgment ourselves?
Absolutely, yeah, no, and apologies that wasn't on there. I noticed that Sharon had done that, so yeah, we can certainly add that into our reporting, not a problem. Thank you.
Councillor Liz.
Thank you to both Sharons, because none of this is easy to manage, and it's obvious that it's quite complex, and you're doing lots of things to try and secure the improvements. My question, and I asked this last year, the sickness levels are much higher in the winter, and we did ask last year whether there was any possibility of having a flu jab organised within Powys County Council, in the same way that they do in health, because the levels of sickness due to coughs, colds, flu, chest, etc., are quite high, and I wondered what you both thought about that. I'll go on to the second question, but I was just thinking that it's possible that the chair might want to defer this, perhaps to have a little report about it. So I picked up from the reports that there's going to be a remodelling of adult and children's services, and obviously I can see that there's a plan to use co-production to do that and to involve staff. But again, added to the other issues that we've heard about today, it's got that potential as always with managing change, to increase staff sickness. So, I wondered, to what extent you'd be able to give us some information about that, but realise that that is probably something that, is worthy of a separate report or a separate update. And then the third thing, it's kind of observation come question. I'm just, intrigued as to why everybody is not using the same format to present sickness. So why, we can't actually overlay the detail of adult services sickness and children's services sickness. So, is there some explanation, about that? Because, my sense is that it would be much simpler for the whole organisation if, the reports look the same, really.
Okay.
Thank you.
On the last question about the reports, I guess we have different HR business support, but that's certainly something that Sharon and I can look into in terms of ease of reference. Councillors, that's not a problem whatsoever, and I completely understand and accept your rationale for thinking in that way.
I cut your work down, I was thinking as well.
Yeah, thank you, councillors.
It makes perfect sense.
Yeah, in terms of the flu jab, I do remember you mentioning this last winter. I'm not sure we've made any progress per se with the delivery of that in terms of within the council. There's probably something that Sharon and I will need to take away from this meeting and reflect on and come back to councillors, if that's okay. I'm certainly aware of social care staff having availability and options to have any updated COVID vaccines, etc. I myself was contacted about 2 weeks ago, actually, in terms of if I wanted the next round of vaccines, which I think is due to be rolled out very, very soon. They didn't mention the flu vaccine to me at that point, but certainly that's a really good point. Completely understand the question, and maybe Sharon and I can take that away to discuss, unless Sharon has anything different to add.
In my experience, I'm not sure what we do in Powys, but my experiences in other authorities is that we have had an offer to staff around flu jabs, and it has had a significant impact on the reduction of respiratory absences. So it is something that if we're not doing it, that I think we should pursue.
Okay, thank you, Sharon. And then the third point you mentioned about, I guess you're talking about management of change and reshaping the services. And I guess Sharon and I are in different places in terms of that reshaping and then development, but more than happy to kind of bring a report to Health and Care Scrutiny if that's appropriate, Chair, in terms of the future, in terms of where we're at with those particular developments.
I think what Councillor Liz is getting at is that where future shaping of services and transformation is happening, there can be a level of anxiety amongst the workforce on how that's going to impact them. And perhaps, and correct me if I'm wrong, Liz, you're getting at how do you capture whether that's causing any work-related stress? Is it do you ask those kind of questions during the road shows? Yeah. How do you manage that? Is that right? Is that correct, Liz?
It's and it's mentioned in the report that there's going to be co-production on that. I think is that right? Both Sharons.
I think yes. a lot of it is, and so a lot of the references in the report are also to external services as well, the transformation and co-production of our external market as well.
So that's what I was interested in, really. How what does that mean in terms of your engagement with staff, and what will you be doing, and how will we see the impact? So and then absolutely what Amanda has quite succinctly summarised. Thank you, Amanda.
So for children's services, I can kind of answer that. We've had engagement roadshows. We've looked at sustainable Powys as a whole. The workforce has been very much part of developing our 3 areas in terms of our integrated business plan. And actually, we're not looking at any radical changes in children's services. We're not looking to kind of change anything on a big scale. It's more about strengthening what we're doing with what I've highlighted, really, in terms of investing in our grow our own and reducing the number of agency workers that we've got. We're not looking at any radical reshaping of the service at all. It's more about strengthening what we've got and then tweaking any areas where there might be some difference. And the way in which we engage our staff is always about what are their views, how are they feeling about anything, because even a new head of service can bring anxiety in itself. Is there going to be any radical change? Are we going to go through another management of change, a restructure? So again, I've been really clear with children's services since I've been in post that no, we're not actually doing that. We are looking at how we can strengthen what we've got and build on the platform that we've developed over the last 12 months. But it's that level of engagement and hearing from staff in terms of how they feel and think about things. We also undertake surveys in terms of the council, in terms of how staff feel about working for the council and how valued they feel be. And we're also doing some joint surveys with Powers Teaching Health Board, which is if that's of interest in the future, happy to bring back a summary of that chair in terms of some of the work around those surveys in particular. But generally that's the sort of things that we do in children's services. And particularly for me, if there are any teams that may have any slight worry about anything, then I absolutely go to that team and be part of their team meeting and hear what their worries are. If there are any kind of emerging trends of worries or anxiety around things, very much as part of the solution for me is to be visible and to hear that and to try and work on solutions with the staff.
Thank you. Thanks both. Thanks, Liz. Councillor Chris.
Thank you, Chair. It was in relation to the starters and leavers graph that you showed for children's services. I mean, I was quite interested when you get the peaks. Obviously, it's pleasing to see the recruitment, and you've mentioned that there'd been a recruitment drive, and that's encouraging that we're attracting people in and that numbers are going up. But the August 22 figure seems to be like out of kilter because it goes up to 7.3. I'm assuming 7.3 whole-time equivalents on the. Is there any reason for that? Was that to do with like age-related retirement or not? Was it for a different reason?
I wasn't in post as head of service in August 2022, and I'm just gonna sort of ask Rachel, really, who's in the meeting with me, if you can recall if there was anything in particular that we were doing at that time. I know that we were looking at exiting a managed team at that time that we had in place, which was called Innovate. So Rachel, is that the reason for that particular upward trend at that particular point, would you say?
I am going from memory, but yeah, I think we'd started to exit one of our managed teams and that caused the spike.
Right, okay, that's helpful. Then in one of the charts you didn't show was then the number of social work vacancies, which I think averaged out for the quarter around about 25. The agency then that you're using, is that purely in relation to those vacancies that you're holding?
Yes, so those agency rates equivalent to the social work vacancies, but we've also got some, I think it's only 1 or 2 additional agency social workers to meet some of the demand that is coming through the front door. So we've actually had to put additional staff into the front door to support the kind of capacity and demand trajectory there. But yeah, it works out otherwise as like for like. Okay,
so it's because obviously agencies cost us more in relation to cost-wise. It's not skewing your budget unrealistic. Is it balancing out overall what you can see, or is it making it varied considerably?
It does vary because obviously the cost of an agency worker per day is considerably higher than a cost of a full-time equivalent. So there is some balance in there, but there is a deficit in terms of the staffing budget because of the agency expenditure. Hence why we're trying to reduce that as quickly as we're able to and invest in our grow our own and fill those vacant positions.
Okay, thank you.
Thanks, Councillor Chris. I've got a few more questions, I'm afraid. So I'm just going to start firing away because I can't see any other hands up. To both of you as heads of service, how do you do your own benchmarking on the data that you get from all of the teams that sit underneath you? Do you do that based on your own experience? I know Sharon Fruin, you said at the beginning about the difference between where adults is compared to the rest of the council, and that's, you know, pretty good from your experience. But do you how do you measure that going forward? Do you get any data from any other local authorities, and do you carry on benchmarking that against the wider local authority in case actually that gap is starting to grow? How do you do that within your role?
I think it's as you described, a mixture really. For some of it is based on my experience. I would continue to benchmark against the authority as well, and also cross-referencing. One of the things we haven't mentioned around absences is health and safety incidents and accidents, and making sure there's no correlation to the incidents and accident rates that are making our absences peak, or and especially around supporting people who may challenge us. And yes, I would be speaking to other colleagues in other local authorities, but also looking at month-on-month trends, year-on-year. Was it the same last winter as it is this winter? So a variety really. Keeping an eye on key teams, whether the demand on any team is showing a spike. If we've got an increased demand in, say, the north of the county, is that resulting in increased absences in that team? And should we be doing something different around supporting them?
So would you get that? You'd get that in your monthly performance report through the KPIs. What would you then do? What would be your actions?
It would be around actually talking to the team managers, talking to the staff, actually looking at the trends, and, you know, depending on what the trend is, it could be different support mechanisms.
Okay, but so that's one way. Would you expect that dialogue to come the other way from the staff up to you if they felt that there was a trend? And
certainly through supervisions, it's a standard agenda item: sickness and demand and performance.
Okay, and does that I mean, I guess I know you've not been here long, but in your experience, is that a two-way dialogue that is free? Does it happen freely, or do you have to push for it? I guess Sharon Powell as well.
It's certainly my short-lived experience of House. It happens freely. I've been very encouraged in the positive and proactive way that managers are managing sickness absence.
Okay.
And it also happens freely within team meetings as well.
Great. And Sharon, is anything that Sharon has said different in your service?
All the same. The only additional thing to add is we do scrutinise vacancy rates as a region, so with the other regional heads of children's service, and also we do that as a national objective with the All Wales Children Heads of Service, and there is a national drive around reducing agency workers across children's services per se. So there is a lot of benchmarking that looks at those particular authorities that might be having more complicating factors than others to try and understand that, etc. So it's almost scrutinised at a local level, regional and national level as well.
Okay,
that's echoed across adults as well.
And Councillor Shan, where do you see your role in this in terms of you know, oversight and what information you're able to gather through, say, the WLGA?
It's not something that I recall being raised in WLGA get-togethers. We have had conversations between us, heads of service, and I, in reflecting on what causes sickness and how much power we have to mitigate against it. I can raise it with the WLGA.
I guess it's whether or not the WLGA hold any data themselves in terms of benchmarking. I don't want to create work for anyone, but it's, you know, if that data's ever there, or if there's ever the opportunity where workforce issues are discussed and you're able to get some qualitative intel really from other local authorities.
It would be useful to compare across local authorities, wouldn't it?
Yeah.
I think it's going to be useful seeing the analysis of the experience and wellbeing survey under Workforce Futures as well, to see how our staff wellbeing compares to our PTHB counterparts as well, and in what way they differ, what measures might be in place in each different entity that contribute, and what they might be doing differently from us. And I'm quite interested in that analysis when it happens.
Great, thank you. So my next question is to do with you've mentioned about the in-house sort of occupational health. I can't remember what you said it was called.
Care First.
Care First, that's it. Yeah. Is that always changing in terms of the offering? Who monitors it? How is it adapted post-COVID? Who quality checks it?
HR have the kind of overarching lead for that service, but it's definitely adapted, and it's grown in terms of different offers that have been offered to individuals since the pandemic. Without a doubt, there's just more opportunity for some different types of counselling based intervention as just one area of that. So it's definitely an area that's grown, Chair.
And does it cost? Oh, sorry.
I was just going to say, we do have data on waiting times and length of referrals being taken up as well.
Okay.
So we do have some data analysis on productivity.
Okay, I guess some of my questions are probably more suitable for HR in terms of whether or not there's a cost associated with this, and then how they measure or not, whether or not that's having an impact, and how you then can go, actually, yeah, this person and this person's been referred to this thing, and therefore, and I can now see 12 months down the line that we've got less of this. So who would be best placed to answer that kind of question?
I imagine that would be Paul Bradshaw. I think Rachel Evans.
Okay. I think I'd like to put that as
agree.
A recommendation from our committee, and that perhaps me and Connor and Gareth will take this offline, and that we could write and ask him for an answer on that. And he doesn't need to come to committee, but it would be good to get a written response, I think, because I'd quite like to know a bit more about that.
And Chair, if it's helpful, in terms of the surveys, he'd be able to provide you with all that workforce operational development work around the surveys and recruitment and retention, because there's a whole programme of work that's happening there.
Okay. And would he be able to narrow that down in terms of your service areas?
Yes.
Yeah. Okay. Thank you. Sorry, my next question. When you address, say there's a spike in stress-related sickness or burnout, I don't know where that would fit in things. Are you able to double check on your systems whether the staff are taking the holiday that they should?
Yes.
Yeah, absolutely. And in fact, we've actually just reminded all staff and supervisors the importance of making sure staff are encouraged to take their annual leave, and to raise any issues or concerns about people not being able to take their leave or not using their leave.
Yeah, I know this is something we've spoken about before, Sharon. I think it's really important that people have their leave to look forward
to. Yeah.
Absolutely. And that they're encouraged to get it in the diary. So no, I'm pleased to hear that that's happened. That's great.
It's also part of ongoing supervisions and one-to-ones. It's a routine agenda item that supervisors pick up. One, because obviously staff need to have their well-being time and they need to have that time off, but also from a service level, what we don't necessarily want to have are lots of groups of staff taking their leave all at the same time. So there's a manageability function to that as well. So that's certainly part of the supervision process.
Great, thank you. Sorry, 2 more questions and then I'm done. The in-house psychologist that's fairly new, when did they start?
Chair, that is a question and a half.
Okay. The reason why I ask is it doesn't massively matter, but as you know, I used to sit on foster panel going back quite a few years, and there were a run of very, very traumatic cases that were in the national news. And I recall speaking with some of those social workers involved in some of those cases and asking them how they were doing, and asking this very question: do you get offered any support for yourself to go through this process? And I'm going back a number of years, like at least 4 or 5 years ago, and the answer was no one has offered me anything. And we're talking not the everyday social services stuff. These were really 2 or 3 really, really national media type things. If I was to ask that question now, should we have a similar type of case, would that answer be very different now? And is that something that managers encourage and ensure happens, or is it still down to an individual social worker to say, no, I could do with some support actually?
A really good question, Chair. Off the top of my head, I think the psychologist has definitely been in post at least 2 years, but it may even be longer, but I can't exactly remember when he was appointed, so I can get that to you specifically. In terms of the trend today, absolutely, and that's part of some of the conversation I had around well-being with yourselves in terms of looking at debriefing sessions. If there's a significant event that actually is very specific, which is really impacting on a staff member or a group of staff members, then actually if I'm aware of that and the senior managers are, which we are, we will kind of signpost that individual or group to have debriefing sessions with the psychologist. Part of what it's called a SWORCH technique is the technique that we're bringing in is also about that debriefing and kind of having those conversations within a protected space to talk about whatever those complications are. But we also have strands of that. So if there are specific reasons, if I wanted to speak to the psychologist about anything particularly that's impacted on myself, I have that as an opportunity. I've actually taken that up myself. So that is there in terms of support for staff on an individual or a group or a team basis. It's also about kind of looking at those trauma-informed practice ways of working, which I know Councillor Sean is really keen on, as are other councillors, in terms of looking at how we can take some of that forward. So it's kind of strengthening how we support staff through that kind of trauma-informed lens, and kind of thinking about it not only for specific services, but within the wider kind of workforce across the council too. So there's lots of conversations happening around that kind of trauma-informed lens too, which all kind of fits around well-being and creating that culture of support.
Great, thank you. I think that's what I expected to hear, but I know it's been a fairly rapid progress, so thanks for that. And my final question is, you've mentioned the positive news story that there are agency staff converting to being our own employees. How do you capture the reasons why? And sorry, I know this is sort of going off the whole sickness thing, but I guess it ties into promoting good practice to ensure that, you know, it's a great place to work. So where we've retained an agency worker, how do you make sure that reason you can share that to another team where actually that good practice could be done there? Yeah, that's my final question. Sorry.
I mean, that's an excellent question. And I think that whilst we kind of capture the agency workers that are converting to permanent, we may actually could really work on building that in a much more strengths-based situation and actually share why they're actually wanting to convert. I don't think we're actually specifically saying that in the data we're collecting, but I think that's a really good observation, and it's a really good selling point, isn't it, in terms of others. From what I hear individually, it's about they really like the culture in Powys, they really like Powys people, and they want to invest their time and energy into Powys. So those are kind of headlines, but I guess
so I think you need to break that down into being much more specific and saying they really like the there's an open door to me, and or they really like the level of road shows where they get to share ideas, so that people can actually have really clear ideas on the mind as to what working for Powys, what we're selling as working for Powys.
I think that's really good observations. I'll definitely take that back, and we can build on that narrative, because
it's so much more than money. It will be balance, and
generally.
I've chosen to work for Powys because I've got this great career progression opportunity, and this is how they're going to support me. Sharing something like that across your whole of the children's teams or the whole of the adults teams could actually just encourage one or two more people to come on. And I will shut up now because I've been talking far too much. Sharon, you've got your hand up, and then Councillor Liz.
Just a point on the agency conversions. There is a caveat that with some agencies there is a finder's fee, and you can have a penalty clause. So the business case needs to be very robust.
Okay. Councillor Liz.
Just a quick question in relation to the agency workers. I kind of noticed that there are significantly more in children's services. I think there was 28 and something like 12 in adult services. Is that proportionate to the number of social workers, or is there more of a difficulty in recruiting to children's services, and hence 28 as opposed to a lesser number in adult services? What is the rationale behind all that, or the explanation?
So going back a couple of years, Councillor Liz, we were up to around 55 agency workers, and that was definitely on the back of a really poor inspection by CIW in 2017-18. That had a real impact on children's services in particular. It did on adult services too, but predominantly we had greater departure rates and leaver rates within children's services at that time. And since then, we've been are reliant on agency workers, and it is a very good downward trend, but we recognise that we needed to do something different in order to attract and retain staff and build from within. So a lot of that is around it's hard work, it's tough work. I'm not saying adult services work isn't. It is very different in children's services. You get scrutinised far more by the media and by the press and by the courts in terms of different situations that you're involved in. There is a national shortage of social workers, but there's a particular national shortage in frontline children's services around safeguarding processes and child protection work. That's a trend that is complicated across the whole of the UK because of the very nature and the work that you have to do in order to be that social worker. So it's really important for us to kind of recognise that, but also build in the wellbeing elements that we've talked about to try and help social workers kind of navigate through those really difficult things that they have to experience in the work that they do. And also we have to reflect, I guess, in terms of opportunities for young people today. There's so many wide range of opportunities to actually do a multitude of different jobs. So it's kind of, I think culture changes in terms of kind of trends of what's popular at different times. And you've got to really want to be a social worker. It's not a job that you can kind of just come into and think that you can be okay. You've got to have the passion and commitment and motivation to actually really want to make a difference. So I guess those pool of young people, when we've got a sort of we've got an aging workforce, aging population and less young people, then your window narrows, doesn't it, in terms of anybody that wants an opportunity to go into social work, whichever strand they want to go in. But certainly in terms of answering your question specifically around our numbers in children's services, it's definitely the impact of the inspection back in 17-18 that created that kind of challenge for us really in terms of recruitment and retention.
Okay, yeah, it's not a job for the faint-hearted, is it?
It's challenging. It is a really tough job, whether it's in adult services or children's services. It's a really tough profession.
Thank you both. Rachel.
Yeah, thank you. I just wanted to come back on an earlier point and an observation around understanding what motivates staff and what's important to them. We undertook a commissioning team away day a couple of weeks ago, and we asked that very question around, what's really important in terms of the role. And we've had the information back from that. And in order of importance, it's really interesting that most people, in terms of importance, have said providing a better future for my family and children, followed by a work-life balance, followed by learning new skills, and then followed by getting paid well. And then it follows on then a range of different reasons. So it's really interesting that actually it's about role satisfaction, it's about having a work-life balance, it's around feeling important in the role, and actually getting paid isn't necessarily as high on the list as we expect or we think. And that's really important for us in terms of how we craft some of our recruitment campaigns, how we understand what motivates staff, so we can make sure that we've got the right conditions within the workplace that are attracting people in terms of their preferences and their motivators. So it's just really interesting. I just wanted to share that with you. We haven't actually reflected that back to the team yet, which we want to do, because we want to test some of that understanding so that we understand that we've collated that correctly. So I just wanted to share that with you.
Yeah, perhaps test what they mean when they say creating a better future for their family.
Absolutely.
What does that actually mean? Do they mean money?
Exactly.
So they've got more money. In which case it's the other one. But no, I completely understand it. Money isn't everything with these things. And actually, from what a lot of people in such high pressure jobs say, it's down to actually whether you're being paid fairly for what you do in terms of the hours you do. So yes, you may have a decent above average salary, but if you're working 60, 70 hours a week with very little supervision, then that's why then, well, people still would say, well, I should be paid more for what I'm doing. So but that's not where their frustration lies. But yeah, any other questions from councillors? No, great. Well, thank you so much for presenting that. That's been, I think it's been really worthwhile for us to get a better understanding of the themes within your departments. And obviously we've got some recommendations and some follow-up I think we'd like to do with HR. So we will take those away and they'll feed into our tracker. So thank you all for coming. Sharon Fruin, I hope your first active scrutiny session has been bearable. But thank you very much. Yeah, Councillor Shan, thank you as well. So officers and Councillor Shan, please feel free to go. I think, Connor, I'd like to look at the recommendation tracker and the work programme off the formal meeting, please.
Okay, Chair.
Thank you.
Thanks, everyone.